Good morning, everybody. This is Chet Jorgensen, MAPE Statewide President. Welcome to our third Tele-Townhall. Several thousand of you have participated in previous town halls, and we're happy you're back with us today. We also welcome those of you who are new today. We have several special guests with us today. Governor Tim Walz will be on the line in a couple minutes, or I guess he already has made it. He's a little early today. As will a few MAPE members serving on the front lines. Steph Meyer with the Department of Health, Lois Tuckey with the Department of Corrections, and Maureen Dunaway with the Department of Employment and Economic Development. We're here again today to answer your questions, listen to your concerns, and stand with you during these uncertain times. Please dial *3 with your questions. We're all proud of the work that all of you MAPE members are doing to try and keep Minnesotans safe from this deadly virus. We applaud all that you're doing to help your fellow Minnesotans simply survive this pandemic. Helping people enroll in health care through MNsure and apply for unemployment insurance. At the Department of Education, we're trying to implement distant learning so our kids can continue studying. We salute all of you that are doing in our correctional facilities. Minute has made it possible for thousands of state employees to telecommute. DNR, PCA, and all the other agencies and colleges are doing their part to keep state government running. MAPE members step up every day to ensure Minnesotans are well cared for and safe. We are proud to work alongside Governor Walz on the front lines to ensure state government continues to run smoothly. And we appreciate the governor saying, Minnesota works because MAPE does. Governor Walz has also said from the beginning of this crisis, we won't just prepare for COVID-19, we will lead. The governor is showing that steady, forward-thinking leadership is what will get us through this pandemic. That has included COVID-19 leave and a push to get the maximum number of people teleworking. We are so thankful for his leadership. It is my pleasure to welcome Governor Tim Walz to MAPE COVID-19 Tele-Townhall. Governor, I'll now turn the microphone over to you.
Thank you, President Jorgensen. I am grateful to you, Lena, and the MAPE leadership. I want to let all members know this team is not just, as I've said numerous times, they don't just have your back, they have Minnesota's back. They're helping shape the policies that move the state forward, and they're making sure, and I'm very much looking forward to hearing from Steph, Maureen, and Lois about frontline work at critical agencies. But please know what you're doing is making a difference. As I've said the other night on the state of the state, there's going to be some tough times to go through here, but we've got the capacity to get through it. And as I was just telling Chet, I got off the phone with a pretty extensive brief with our partners in the modeling at the University of Minnesota and MDH. What we're doing is working, and there is a very Minnesota path forward to both protecting our most vulnerable, to extending testing and sentinel measures out there, and getting folks back to work and moving back towards a more normal lifestyle. There is a way that we can do this. We're at this point in time, because of all the work you're doing, holding our own against this. But I want to be very clear. The lack of personal protective equipment is putting way too many Minnesotans and folks on this call at unnecessary risk. We are spending all of our energy to try and secure that. And the testing, we need to have more of that to allow for us to be more strategic in what we're doing. I certainly hope that the COVID leave policy that your leadership made absolutely clear was necessary is working for you. We know that so many of you have spouses that are unemployed now, child care issues coming up, all the other concerns are out there, in addition to keeping the state safe and continuing to lead. So I'm grateful. I'm going to mute my phone here for a minute and listen to stories from the front lines and then come back on again. But thank you all for what you're doing.
Governor, thank you for joining us today and for leading Minnesota through this pandemic. This is Lena Jamoli, Executive Director of MAPE. Can't be easy being governor right now, and we've all been grateful for your thoughtful, decisive, and transparent leadership. We're also grateful to all of our members and the work you've all been doing to keep state services functioning during these challenging times, and some of you are doing that in conditions that put yourself and families at risk. We're thankful for your dedication. Governor, we wanted you to hear directly from some of your employees who've been working hard to keep Minnesota moving. There are thousands of stories we could have picked from a variety of agencies, so the next 3 stories don't capture all the work our members and your employees have been doing, but they're the tip of the iceberg of the state workforce. First up is Steph Meyer from the Department of Health.
Hi, thank you. As Lena said, I'm Steph Meyer. I serve as MAPE's Region 9 Director, and I'm also one of the senior epidemiologists at the Minnesota Department of Health. And we have an incredible team at MDH. It's been all hands on deck, drop your usual work, get involved. I mean, everywhere you turn, people are stepping up. They're working until 8 or 9 o'clock most nights. We have people here every weekend. And I'm proud to be part of this response, working every day to keep Minnesotans healthy and make Minnesota a safe place to live. In our case investigation team, we're contacting confirmed COVID-19 patients, and we're talking with them about their exposures. We're finding out who they've been in close contact with, and we're handling isolation and quarantine. And we've been following up with healthcare workers. If a physician, for example, were to test positive, they may have exposed their colleagues, their patients, the healthcare staff who tested them. So we're assessing all those risks and trying to ensure we have a healthy workforce in our hospitals, in our clinics, our long-term care settings, group homes, and many others. We're trying really to draw a circle around each case, find the contacts, isolate and quarantine where needed, and then move on to the next case. And if we can contain illness in these spaces, you know, it's, as Governor Walz said, it makes a difference. It's going to make a difference to the burden on our healthcare system. And really, in a small town, if you have 2 nursing homes where everyone gets COVID-19, what do you do for your community? Our hospitals will be overwhelmed to care for the most vulnerable folks who become ill, and we've been hearing it from our colleagues in other states. And this is where we'll need to work across agencies on plans to assist in staffing facilities just to stop the spread of disease. I'm really grateful for the emergency care that my kids are able to get. I've got 4 kids, and I wonder what happens if I get COVID-19, or what if one of my kids gets it? And it keeps me up at night, but Governor Walz, I can't thank you enough for making education a priority for our kids. We couldn't do it without that support. And this is why we're also trying to work with our agency to operationalize remote work, because we know that someone here is going to eventually test positive for COVID-19. The epidemiologists here on staff, we talk about it every day, and as careful as we are, we know it's likely that someone here will get it, and then what happens? So we're working towards solutions to keep ourselves safe and keep our operations running smoothly, because we really care about the state of Minnesota and what we're doing. So thank you.
Thanks, Steph. Next up is Maureen Dunaway from DEED.
Hi, this is Maureen Dunaway from DEED, and I work in the unemployment insurance program. And I can say each and every one of us at UI is working hard to serve Minnesotans. We are on the phone the entire time during business hours, leaving us to work overtime to determine eligibility. We're thankful to those who have come back from retirement and those who are redeployed to us and are getting a crash course in how to do our work. But we are still short-staffed. In the last 3 weeks, we fielded over 300,000 applications. Wait times are, as expected, longer than usual, leaving some callers frustrated. But many callers are thankful and understanding. If you know of anyone who is going to apply, please encourage patience and maybe give them a hand. And for the first time at UI, people are beginning to start teleworking. We started this last week. I was approved last week, and so far for me it's going well. Not everyone is being approved for this so far, so I am hopeful that more of my colleagues will soon be able to join me. These are certainly unprecedented times. I thank our department and all of my fellow MAPE members all deserve kudos. Keep up the good work, everyone. Thanks.
Thank you, Maureen. And the last member we'll hear from today is Lois Tuckey from the Department of Corrections.
Hi, thank you, Governor. My name is Lois Tuckey, and I provide deaf and hard of hearing services in the Department of Corrections. At a time when the entire state is encouraged to stay at home, many of us at the Department of Corrections are serving Minnesotans on the front lines, both inside our correctional facilities and in our communities. MAPE professionals within our facilities continue to provide critical services that our offenders rely on, including much-needed mental health services. Our supervised release agents and our case managers play an essential role in our offenders' reintegration into society. Facility wardens here have developed and implemented stay with unit plans, which is a prison's version of stay at home. And our agency has modified programming schedules to encourage social distancing as much as possible, but it's a challenge. Our employees working inside the facilities and in the community are working hard to manage our population, but are at increased risk of contracting COVID-19. We know you're working to ramp up production of personal protective equipment, and we're thankful for that. We're also grateful that legislators have recognized the need for workers' compensation for frontline responders, including all essential DOC staff. This is an unprecedented time in our world, so it is vital that the agency be creative and work with the employees to develop new approaches to staffing, schedules, and programming plans in our facilities that keep everyone healthy and safe. And we appreciate the work that you're doing. Thank you.
Thanks, Lois. While our members are keeping Minnesotans safe, our job as a union is to keep our members safe and make sure they have what they need to do their jobs. Governor, we're not naive about the effects of this pandemic on the economy and the state budget. It's not yet clear how much the federal government is going to support state government budgets. We look forward to working with you on a fair and transparent process around the impact on state employment. And we ask that you continue to work with us, especially as the decisions get tougher. So, Governor Walz, do you have anything you'd like to respond or react to our members? We've got almost 4,000 people who have joined us on the call now.
Well, yes, Lena, thank you. And those are three of literally 4,000 stories. These are also the stories that will be told for years, if not generations to come, about what happened during COVID-19 and who was there to respond. The historic efforts of MDH doing the tracking, we're not going to rest on our laurels, but at this point in time, our infection rates are lower than any place in the country. We know that one is too many. The same thing I say a lot about UI, and these are folks that many people did not know what they did for so long. We had low unemployment rates, and they simply did their work and did it well. When the system came under strain, UI systems across the country crashed. Checks have not been paid in Connecticut for over 3 weeks. I got a text today from someone who applied and had a deposit in 3 days in their bank account and said that nothing could have been done to make them feel more at ease than that. So I want to make that case. And then the folks at DOC, corrections is always a challenging job. We know from aging facilities to overcrowded facilities to just the challenges that come, trying to keep themselves safe at the same time that they're trying to show basic humanity to those who are incarcerated is heroic work. And I can assure you, President Jorgensen and all of your members on this, when this is over and we pick up the pieces and do state budgets, we are not about to undermine the very safety net and the people that made things better and saved lives at the expense of trying to balance a budget. So there's going to be hard decisions to make, but everyone on here can rest assured it is not going to be the time to pull back the very things. I am so proud that Minnesota has a robust state workforce that are true professionals because it's right now when you needed them. So those that are going to come when this is over and tell us that we need to get rid of all of these things, these are the very things that got us through it. So I'll continue to work with you. I've appreciated the incredible amount of cooperation, and I think it's important to stress to the 4,000 members on here, the leadership of MAPE is at the table on all of these decisions. Their voice matters, and they are doing right by you. So, Lena, thank you all. I'm going to jump on another call, but please forward the rest of the questions that come from your members to us, and we'll make sure we get back to you.
Yeah, Governor Walz, thanks so much for being on the call with us today. We know that you're kind of on continuous calls. I also want to thank Steph Meyer, Maureen Dunaway, and Lois Tuckey for being on the call with us today. Lena and I are looking forward to answering your questions, so please keep them coming our way. If you have any questions, please hit *3 on your phone.
Thank you, Governor.
All right. You want to take the first one on the contract?
Yes. The first question here is there an update on the legislature approval of our latest contract? Well, as many of you know, the legislature is not in ordinary session. They go back today for a vote, and they'll reconvene next week, but we don't know what their schedules are going to look like. We are working hard to make sure that our contract gets approved before the end of the session. which will be the end of May. So I would encourage you, if you're on the call, to reach out to your representatives and your state senators and encourage them to make sure that the contract gets approved and that it's important to keep all of the state workers in Minnesota working.
The next question is, daycare centers are considered essential businesses and ours remains open and we don't qualify for COVID leave. For my infant's health and safety, we are keeping her home. Could COVID leave be adjusted to help families where daycare isn't closed? At this point, your child would have to have a pre-existing condition that we require you to keep them home. And I can, even though my son is 21 years old, I remember back when he was an infant and I would have been terrified to send him to daycare with this going around. But as it is now, the COVID leave doesn't apply unless your child has a pre-existing condition. But we have been advocated for a change of that. But I don't know, I haven't heard anything back about that getting changed.
All right, the next question is, fishing is listed as an essential business. How do DNR fish hatcheries and walleye spawning fit into this classification? So it sounds like this is a question from the DNR, but it is applicable for all the state agencies and state employees to be aware of this. The state workforce is going to be classified into priority 1, 2, and 3, and 4, and those are related to work functions. So priority 1 are the critical services, the frontline services, and the 24/7 operations. Priority 2 are the back-end operations that cannot, there can be no disruption in services. So, for example, everyone in the Department of Revenue is priority 2. And then priority 3 is for services that could be disrupted between 6 and 30 days. And priority 4 is any services that can be disrupted for longer than 30 days. So while I don't know the answer to your exact question on the DNR fisheries, that the DNR should be telling employees, and all agencies should be telling employees what priority category you fall into. And if you have questions about that or any feedback, you can email us at action@mape.org. We're trying to get a handle from MMB on the statewide functions of priority levels, but the agency should be letting the employees know.
Okay, the next question relates to Min-State. With the severe decline in enrollment and the loss of reserves, will the state help fund colleges until we get back to normal to avoid layoffs? I really hope so. It's really, what gets funded and what doesn't get funded has really been, kind of a moving target at this point. I think in the governor's State of the State and one of his press conferences, he talked about the support that the state got from the federal government after the 2008 crash. I'm hoping that the governor is, working with our congressional delegation to try and figure out what Minnesota is going to need for that, and part of that has to be keeping our colleges fully funded.
The question here, can agencies still approve vacation time while this pandemic is going on? And if you have questions, please click *3 to get your questions answered. So yes, the agencies can still approve vacation time. They can also still deny vacation time. Our contract language does allow the employer to deny vacation time if there is a business need. And so my advice would be to work with your supervisors, and if you have problems around vacation time, let us know.
The next question is, because the COVID leave has recently changed, do they need to resubmit the paperwork? I think what's going to happen is the COVID leave is going to be kind of changing a little bit every week for various reasons. I think most of the time, at least so far, it's been to our benefit that the COVID leave has changed. you're going to have to stay in contact with your supervisor and your HR person as to whether you need to refill it out. I think for the most part, most agencies and colleges are not asking people to refill out the paperwork because the new leave has been more generous. But it's up to them to tell you if it needs to be. So I would just say stay in contact with them.
Next question here is, can we get vacation and sick leave accruals while on COVID leave? Does time out on COVID impact retirement benefits? The intent of COVID leave was a few things. One was to keep people working and teleworking as much as possible. The second was to make sure to still give people paid time in a way that they didn't have to use their sick and vacation accrual, so we didn't drain all our accruals. But while on COVID leave, you will not be able to accrue additional vacation and sick leave time. And if you're taking it intermittently, the accrual will be prorated. COVID leave would not impact your seniority and would not impact other benefits like health insurance or retirement.
Okay, on COVID leave for underlying health, persons on COVID leave for underlying health reasons, how long will the COVID leave last? Through this crisis, indefinitely. Now, at some point, the employer is going to say it's safe enough for you to come back to work. You may disagree with that. I think at that point you need to work with your doctor and you need to work with a business agent or a steward as to whether it's safe for you to come back or not. But as long as the emergency order is in place and the COVID leave exists, you should be able to stay on it.
Yeah, there's a question here from Andy. MMB keeps changing the COVID leave policy. How does this impact people who are currently out on COVID leave? Well, that is the truth. We've kind of lost count on how many changes. There's at least once or two or three changes a week, maybe sometimes. And some of it has been to clarify certain things. Some of it has been to make sure the COVID leave is in line with federal regulation, new federal regulation. And most of it has been either clarification or expansion of the COVID leave. So the changes are a good thing. It does make it more chaotic to administer,